This presentation discusses the various methods that insurance organizations use to pay healthcare providers. The most common method is fee-for-service payments. This is the traditional method of reimbursing providers, where the provider is reimbursed for each medical test or procedure that a patient receives. This method is often criticized because it may lead to overutilization of medical tests and services. Bundled episode payments reimburse providers based on the patient's diagnosis. This payment method is commonly used for maternity claims, where the providers are paid a fixed amount for all services leading up to the delivery. It is also sometimes used for Medicare claims. Capitation and global payments refer to a system where providers are paid a fixed amount per member per month. This payment covers all services provided to the member. In some cases, high-cost services, such as advanced imaging, may be carved out of the capitation agreement. This type of payment model gives providers a strong incentive to reduce overutilization and maximize preventative care. It is the foundation of the HMO type of business model. There are many different fields in the APCD that record the various amounts paid to providers. The billed amount field records the actual amount that the provider requested for the services. The allowed amount is the maximum amount that the insurance organization has agreed to pay the provider for those services. The allowed amount is often substantially lower than the billed amount. The allowed amount represents the total amount that the provider will actually receive for the claim. The paid amount field typically refers to the amount paid by the insurance company. This amount excludes member cost sharing. For capitated claims, this amount may be entered as zero in some systems or as the fee-for-service equivalent in others. The fee-for-service equivalent is a statistical value that represents the estimated amount the insurance organization would have paid for the claim if it had been paid for under a fee-for-service agreement. There are many different types of member cost-sharing arrangements. Copayments are the most common. Copays are out-of-pocket payments that the member makes at the time of service. Copays are often described as an amount per visit. For example, an insurance policy may charge a $20 copay for an office visit to the primary care physician, a $50 copay for an office visit to a specialist, and a $500 copay for an emergency department visit. These copays are designed to encourage members to choose the lowest cost source of appropriate care. Deductibles are an amount that the member agrees to pay for out of pocket before the insurance company will begin paying for medical services. Deductibles are popular among healthy individuals who are able to pay lower monthly premiums by agreeing to first pay a deductible. Coinsurance is another form of member cost sharing. Under a coinsurance agreement, the member pays a fixed percent of each medical bill. The primary benefit of a coinsurance policy is that it allows a member to pay a higher share of their medical bills in exchange for lower monthly premiums. Out-of-pocket maximums are another important feature of most insurance policies. When the amount of a member's copays, deductibles, and coinsurance exceeds the out-of-pocket maximum, the insurance company will pay all additional bills. This feature of the insurance policy is designed to prevent bankruptcies due to medical bills by capping the total amount that a member will pay in a given year.